Hello, my name is Sarah Thompson, and I'm a third-year pharmacy student at the Benemedi Fish College of Pharmacy at the UT Tyler, and I'll be going over nicotine gum with you today. Nicotine gum is also referred to as Nicorette and nicotine polyacrylates gum, and there are many other dosage forms of nicotine replacement, but we're just going to focus on the gum for today. Nicotine gum is used as temporary nicotine replacement therapy for smoking cessation. This medication will help reduce any withdrawal symptoms that are associated with trying to stop smoking. So it's very important to know how to take this medication in order for it to work properly. Before you do anything, do not eat or drink anything 15 minutes prior to chewing the gum. Upon a craving, take one piece of gum from the packet and place in the mouth right after removing it from the packet. You want to begin chewing very slowly until a pepper-like or tingling sensation occurs. Once this sensation is felt, place the piece of gum between your cheek and gums of your mouth. Allow the gum to just sit there between the gums and cheek until the tingling sensation ends. Once the tingling is gone, begin chewing again slowly until the sensation comes back. Place the gum between the cheek and gums in a different location. So if you put it here, maybe you want to put it over here this time. Continue this chew and park method for about 30 minutes or until the tingling, peppery sensation is gone. So this regimen is kind of tricky because the dose is going to change throughout the 12-week regimen. So however will help you remember that this is going to change, maybe write it down in a calendar or put it in your phone, whatever will help you remember that this dose is going to change throughout this regimen. So I'm going to go over it real quick with you. So it is a 12-week regimen. In weeks 1 through 6, you will chew one piece of gum every 1 to 2 hours with a max of 24 pieces a day. It's recommended that you chew at least 9 pieces a day for the first 6 weeks. Weeks 7 through 9, you want to chew one piece of gum every 2 to 4 hours. And weeks 10 through 12, you want to chew one piece of gum every 4 to 8 hours. So as you can see, the dose is going to change throughout the 12 weeks, and you will be chewing less frequently throughout the regimen. If you happen to miss a dose, you just use the missed dose as soon as you think about it. If it's as close to the time for your next dose, just go ahead and skip the missed dose and continue taking the medication when you normally would. Do not take 2 doses at the same time or extra doses. Some side effects that you should be aware of are signs of allergic reaction. So like rash or hives or feeling like your throat is closing up. Signs of high blood pressure, so like a really bad headache or feeling like you're going to pass out. If you have mood changes, feeling confused or feeling tired or weak, pain in the chest, fast heartbeat or abnormal heartbeat, upset stomach, diarrhea or vomiting, feeling shaky or having cold sweats, change in hearing, sore throat or jaw pain, trouble sleeping or having bad dreams, feeling nervous or excitable, feeling joint or back pain, irritation where the drug is used. So with the gum, you may feel irritation in the mouth, flu-like signs, or gas. So some of these can be due to the dose not being strong enough and you're actually having withdrawal symptoms. And some of these can be due to the dose being too strong. So let your doctor know as soon as you have any of these side effects, and they can help find a dose that's right for you. So some things you should tell your doctor before starting the medication. First, you want to tell all your healthcare providers that you are taking this drug. So that includes doctors, nurses, pharmacists, and dentists. Let them know if you're taking any other drugs to help you quit smoking, if you have high blood sugar, if you have phenylketonuria or a low salt diet. Some products have phenylalanine or sodium in them, so that's important for your doctor to know. Give your doctor a complete list of all your medications. That includes prescriptions, over-the-counter medications, natural products, and vitamins. Let them know if you're pregnant, planning to become pregnant, or if you're breastfeeding. And finally, if you have any dental work. Nicotine gum should be stored in a dry area at room temperature, protected from light, children, and pets. Nicotine gum should be disposed of properly, so you want to wrap up the gum after you're done with it and throw it in the trash. Do not flush it down the toilet or pour down the drain. Okay, so to recap, I have a few questions for you. First, which of the following is correct way to use nicotine gum? Is it A, chew continuously and quickly, B, chew continuously and slowly, C, chew slowly and park the gum in between the gums and cheek, alternating spots each time you park the gum, Is it D, chew 2 pieces at the same time? I'll give you just a second, okay? All right. Very good. Yeah, so C is the correct answer. A is incorrect because you do not want to chew it continuously and you do not want to chew it quickly. B is incorrect because you do not want to chew it continuously. And D is incorrect because you only want to chew 1 piece at a time. Okay, next question. Which of the following is false about the 12-week nicotine regimen? Is it A, the gum may be chewed one after the other to reduce cravings? B, it is recommended to chew at least 9 pieces of gum during the first 6 weeks? C, the maximum pieces of gum per day is 24? Or is it D, as the regimen progresses, you will chew the gum less frequently throughout the day? I'll give you a second. All right. Great job. Yeah. So the false statement is the gum may be chewed one after the other to reduce cravings. You do not want to do this. You want to stick to the regimen where weeks 1 through 6, you're chewing it every 1 to 2 hours. And then weeks 7 through 9, you want to chew it every 2 to 4. And then weeks 10 through 12, you want to chew it every 4 to 8 hours. All right, last question. Which of the following is not a side effect of nicotine gum? Is it A, mood changes, B, trouble sleeping or bad dreams, C, sore throat or jaw pain, D, diarrhea, E, low blood pressure, or F, joint or back pain? I'll give you a second. All right, that's correct. Yeah. So we're not worried about low blood pressure. We're actually worried about high blood pressure when we're taking this medication. So like I said earlier, you may feel like an intense headache or feeling like you're going to pass out. That could be due to high blood pressure. So if you do not already have a blood pressure cuff, I would recommend buying it and monitoring your blood pressure while taking this medication. Okay, well, I hope that was helpful. If you have any other questions, you can click the link below this video to read the patient education pamphlet for more information on nicotine. If that doesn't answer your questions, do not hesitate to reach out to your doctor or pharmacist for any other questions or concerns that you may have.